Hi, everyone. I'm Juan Serrano. I'm a PhD student at Penn on the Neurosurgery rotation at Hub, and I'm delighted to spread to you a topic tying a bit of my own PhD research to neurosurgery, and that is the prognostic value of APOBEC3 expression and influence on treatment and response to RAF inhibitors and low-grade gliomas. Now, as many of us know, glioblastomas are one of the most devastating diagnoses to receive and manage both surgically and medically. They are among the most common malignant primary brain tumors and are noted for the rapid growth, high degree of microvascular invasion, and low overall survival at just 15 months. Our current therapeutic strategies involve maximal safe resection, followed by radiotherapy and chemotherapy with temozolomide. However, as noted prior, their aggressive growth makes recurrence nearly assured, with median survival after recurrence at barely over half a year. Now, glioblastomas are one of many distinct gliomas, which are classified by many factors, including their genomic profiles. In 2021, the World Health Organization recategorized glioblastomas as being exclusively IDH wild type and incorporate many other genetic features to further delineate further subtypes of gliomas. So tumor molecular profiles still has many unanswered functional questions, such as how these low-grade gliomas progress to higher grades, which genetic alterations underlie more aggressive and resistant tumors, and if there are any further biomarkers that offer predictive prognostic or therapeutic value. Now, some of these questions, as they relate to a particular class of DNA-modifying proteins, the APOBECs, were asked by researchers at Beijing when they studied the influence of differential APOBEC3 expression on both prognosis and response to chemotherapeutics in low-grade gliomas. Now, for a bit of background, in the early 2010s, genomic profiling of patient tumors revealed a mutational signature found in over 50% of cancers across many tissue types. And this was characterized by clusters of cytosine mutations found in particular TC sequence contexts. Now, this was eventually attributed to members of the APOBEC3 subfamily of cytosine deaminases, which normally have an immunological role in targeting cytosine in single-stranded DNA of retroviruses to prevent the replication during infection. However, in the context of cancer, dysregulated APOBECs can target genomic DNA when it becomes single-stranded during events of replication or repair, which, as we know, cancer tends to have a high degree of. Hypermutation of genomic DNA can, of course, lead to cell death, but hypomutation can lead to just enough of a tumor mutational burden to present evolutionary opportunities for driver mutations and novel mechanisms of resistance. As such, APOBEC3 expression has been highly correlated with faster tumor progression, development of chemotherapeutic resistance, and worse patient outcomes. And so this begs the question, is there a role for APOBEC3 enzymes in the pathogenesis and treatment response of gliomas? Now, to get a better idea of APOBEC3 expression and overall survival in the context of low-grade gliomas, these researchers used RNA sequencing and clinical outcomes data from 420 patients of the Genomic Data Commons and constructed Kaplan-Meier curves. As we can see here on the left, we can see that for prognosis of patients with tumors expressing high levels of any APOBEC3 family were significantly worse. Furthermore, we can see that wild-type expression of IDH was found in primarily low-grade gliomas with high APOBEC3 expression. As we know, IDH mutational status defines tumor subsets with distinct pathogenic origins, as well as influence the prognosis of tumors, where IDH wild-type gliomas tend to have worse outcomes. Next, patients were stratified as high risk or low risk based on a risk score calculated from the individual tumor expression profiles of each of these APOBEC3 subfamily members. As we can see on the bottom left, those in the high-risk group with overall high APOBEC3 expression had worse outcomes compared to the low-risk group. The risk score was then used to construct the 1, 3, or 5-year survival probability nomogram based on patient age, tumor grade, and the calculated risk score. This prognostic nomogram was further validated using independent data from the Chinese Glioma Genome Atlas and showed high predictive value for all 3 prognostic time points. And overall, what this data and that of the previous slide is revealing is that, like IDH mutational status and other current tumor biomarkers, APOBEC3 expression can be used for prognostication and possible risk stratification for patients, which could direct more aggressive treatment management to those patients with tumors of high APOBEC3 activity. Now, to further explore the influence of APOBEC3 signature on tumor behavior, drug sensitivity data on NCI-60 cancer cells was used to compare response to treatment in low and high APOBEC3 tumors. As we can see, for some of these compounds, particularly those of the BRAF inhibitor family, high APOBEC3 expression correlated to decreased chemotherapeutic sensitivity. This further demonstrates the value that tracking APOBEC3 expression could have on medical management, as it could influence the choice of chemotherapeutic given the propensity of APOBECs to provide a route for the gain of mutations that confer drug resistance. Now, immunotherapy for gliomas is still in very early development, and deciphering which patients will benefit the most from these treatments would be a valuable tool. Looking at the differential expression of immunotherapy markers like PD-L1 and CTLA4 in low or hypobec expressing tumors, we can see there's a generally higher expression of some of these markers in the high APOBEC3 tumors, which could imply that patients would have better response to immunotherapies targeting these markers. So overall, we've seen that APOBEC3 expression carries prognostic value not just for overall survival, but perhaps also for a distinct response to either chemotherapeutics like BRAF inhibitors or immunotherapeutics. Now, while the study does not delve deep into the specific molecular mechanism behind APOBEC3 influence on tumor progression response, further research can help elucidate which pathways tend to be more mutated by APOBECs and thus are real opportunities for targeted therapy. Direct targeting of APOBECs can also prevent tumor evolution and is a viable option, although at the moment there are continuing limits to this approach. Some of these limitations include that, as you can see on the left, APOBECs work through DNA mutation, and so the expression at certain time points does not always correlate with the overall mutation signature left behind. In other words, tumors which currently do not have high APOBEC3 expression may actually already have surges of episodic overexpression in the past and have a current strong mutational signature. Another limitation is that inhibitors of APOBECs are still in the very early stages, with much of the focus on high-throughput screening of small molecules, although biologics such as protein-derived anti-deaminases and DNA-based inhibitors have also been developed. However, they're still lacking in both potency, specificity, and effective delivery, particularly the latter two classes of compounds. However, while the field is still young, I think there's a lot of hope that APOBEC status may soon serve as both a prognostic factor and a potential target for novel therapeutics. And thank you, that's all. I appreciate it, and thank you for your time. Here are the references.